Kate, and today's Talk with the Doc is on puppy care. I'm with K plus K Caring for Creatures Veterinary Hospital, and today's guest star is Ren. This is one of our technicians' newest puppies. Ren is a Staffordshire Bull Terrier, and Ren is now 9 weeks old. So for puppies, some things to know before you get a puppy is they do need vaccines. So puppies should start receiving vaccines at 8 weeks old, and they need a series of 3 parvo distemper shots. Parvo distemper shots are very important because parvo, especially in the valley here, is very common. Parvo is a virus that can live in the soil, and if your puppy gets parvo, it can be life-threatening. Parvo attacks their GI tract, can make them vomit and have diarrhea, as well as attacks their white blood cells, so then they don't have the adequate white blood cells to fight off the infection. After your puppy will get his first parvo distemper shot at 8 weeks, and this does not mean that your puppy's covered. Ren is still not allowed to go outside, because after the first parvo distemper shot, he's only partially covered. Lots of puppies will still get parvo after their first vaccine. It's not until they have all 3 vaccines that they're fully covered. So their first one is at 8 weeks, and then the vaccines, 2 more after that, 3 to 4 weeks apart. Another vaccine they'll need at 4 months, they need a rabies vaccine. The rabies vaccine is required by the county, and you have to register your dog with the county, and they'll ask for the rabies vaccine. Another vaccine they need is a Bordetella vaccine or kennel cough vaccine if you're planning to take your puppy out. Kennel cough is basically like the doggy cold, and if they're going to go outside of your house on walks or to dog parks, PetSmart, things like that, they will also need a kennel cough vaccine. No biting. Until your puppy is fully vaccinated with parvo distemper vaccines, we recommend not going to places such as dog parks and pet stores. Dog parks and pet stores are one of the #1 places where dogs can get germs because people will take animals there that are not fully vaccinated. As you can see, Ren, once he's fully vaccinated, needs to go to some puppy classes. Another thing puppies need is deworming. Puppies can often get worms, and you can tell usually by their kind of pot-bellied appearance. Ren was recently dewormed, and his belly's kind of shrinking now. They'll often get kind of a pot-bellied distended abdomen if they have worms. Puppies should ideally be wormed right around 8 weeks when you first get them. And it's not uncommon after you deworm them. Don't be surprised if you do see them pass worms in their stool. Another important thing is spaying and neutering. Ideally, this should be done younger for 2 reasons. 1, when they're young, the procedure is easier on them. They recover faster. And 2, the price is much cheaper. Ren is only 15 pounds now, so his anesthesia and medication requirement is much lower because of his light weight. And when he is full grown, he will probably be close to 50 pounds. So his procedure will about double in cost by the time he's an adult. So cost is often a factor for spaying and neutering. So if you do it younger, you can save yourself some money, and it's easier on them as well. So that was our Talk with the Doc. If you would like to submit a request for next week, let us know on Facebook.